She is going to share information about the role of her division and the work that she's been doing, especially this year during the COVID response. And she will share with us her passionate perspective on consumer engagement. She's a huge champion of consumer and community partnerships with health services, and she's going to share today her hopes for Queensland to deliver healthcare in an increasingly cultural and person-centred way. So welcome, Barb, over to you.
Oh, thank you, Melissa. Look, thank you, everyone. It's such a privilege to speak to you, and it's so lovely to see all your wee faces popping up on the screens. It's a joy, honestly. Can I also pay my respects to the traditional owners of the land on which we meet, and those elders past, present and future. I'd also like to just start off with my mihi from where I come from. So tēnā koutou, tēnā koutou, tēnā koutou katoa. Noa whakatū ahau, ko Phillips te whanau, ko Barb ahau. Ka nui te mihi ki a katoa. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you very much for allowing me to speak to you today. It really is a privilege. As Melissa says, I'm the DDG of Corporate Services, and I'm also now the DDG of the Supply Chain Surety Division, which is a new division which I'll talk a little bit about today. I've only got 15 minutes, and I've given Mel and the team absolute carte blanche to cut me off because I know I'll talk way too much. But I am staying on. If there's any questions, Mel, I'm more than happy to take them and take them offline if we need to. It wasn't a hard call for me to come and talk to you about consumers and consumers' engagement. For me, it's just a cornerstone of the way that we should work. And it's been something that I've had throughout my whole career, is the privilege of working with consumers and having consumers sit beside me and work with me. And I've worked for consumers in a variety of roles. And what I can tell you, and I know I'm talking to the converted, is that unless we have that relationship and that engagement and that willingness to co-design, to have conversations, to understand what it is that we need to do, we will never get what we are all hoping to achieve, which is a greater health system for everybody. The voice of the community is incredibly important. And the more that we can engage that and open up the channels for that to happen, the more value and greater the service we will be able to deliver back to the communities that deserve us to be able to do that. So I'm already one of the strongly converted in that sense, and work very hard to try and enable that. I'd have to say it has been really challenging, as I'm sure it has been for everybody on this call and in the wider community, in terms of the experiences we've all had through COVID. And everyone's had a different experience and everyone has a different story. But I'd just like to commend you all for the commitment and the continuing engagement that you bring to every conversation that you have, not only as a consumer, but as a fellow human being in a world that seems somewhat chaotic and difficult to navigate. So I'm incredibly grateful for you all to continue doing that for us and for everybody else. One of the things that I thought really long and hard about over the weekend when I thought about this discussion with you all was corporate services is a service within the department. And I know sometimes we've talked about the department as an impenetrable building or structure that can seem very hard to navigate. But corporate services, in my view, is really like the underpinning way of making the world turn in terms of the department. So we have all of the core services that help the department do the work it needs to do. But more important to that, we have an ability to cross over the whole range of areas within the department, and we try and do that a lot. So we see ourselves as the enablers and the facilitators and the linker-uppers, if you like, of the department. And that for me is a key role that corporate can play. And I think that we are getting better at it. I think it's still a work in progress. I think a lot about the pre-COVID world and how people have talked a lot about how we need to get back to the new normal. And a challenge that I would like to put up to you today is, I don't know that the pre-COVID world was that good, frankly. in terms of some of the work that we needed to do. We were far from perfect. I would like to think that we take the opportunity now, and I was listening to John Pickering, who some of you may know, and he had this great phrase about embrace the abnormal. And I think that's something we could do really well. I don't think we should be seeking to go back to whatever pre-COVID looked like. I think we have an opportunity here to make a difference, work differently, think differently, react differently. And I think that's something that we need to all consciously do. Otherwise, we will fall back into what is our known behaviour. And, you know, I'm not sure that that did us as best a service as we could do now. So I'm very keen that we look forward and we look about what we can do now, how we make a difference, because we're working through different phases of the pandemic. Nothing is the same, and we will go back and forth across those phases. I like the structure. The Grattan University put up a structure about the 3 phases they saw of the pandemic. The first being the rescue phase, which is a very reactive, have to deal very quickly, very reactively to issues that come to mind. We then go into more of a recovery phase where we start having an opportunity to build different cornerstones, different ways of working, and eventually we get to a phase that is about rebuilding and really developing stronger, I guess, structures and ties to the first 2 phases. And I think that's something we really need to think about. From my position in corporate, that's something we're really considering about what are the new ways of working and how can we do it? How do we build on the relationships that really served us well in that rescue phase? I was incredibly grateful that I had the relationship, firstly with Consumers Queensland, but also with other NGOs, other stakeholders that enabled us to have the conversations that helped us hear what communities needed. And, you know, we can never replace that. That ability to hear what the community needs is something that we can't assume or replicate in the centre. It doesn't work like that. And we need to build more channels for that to occur. In terms of the supply chain, one of the commitments that I made very early on to the Deputy Premier was he wanted to be able to say that he had mechanisms and processes in place that safeguarded not only the clinical and medical workforce, but everybody in Queensland that needed to access PPE and how they could do that. And so we made a commitment that we would work to a strategy to achieve that, and that was launched last week. That's been 6 months of really intensive, incredibly hard work about what it is we need to do to make sure that we broaden both the services that we could deliver, but also our procurement and our supply chain, and how we do that across a state that is daunting. But we need to be bold, and I think we have been. And I'm really keen that we have further conversations about how we can do that and work with you all about how that works better. It's not just for hospital services to know about how pains and procurement and PPE and how that works can be done. And I've worked quite closely with the clinical networks. Gillian Farmer has done some incredible work in setting up networks that enable us to talk about PPE in a very evidence-based, informed way, and we need to continue to do that. One of the other things I'd just like to put on the table is that how we can continue to build the conversation that we're having about what's important for people to access services and how we do that. I'm very keen that that's something that we need to be doing now. I know we're in caretaker mode, but the work doesn't stop, and neither should the conversations. So I think that's a piece of work that we're looking really closely at, working closely with Haylene Grogan here in terms of Aboriginal and Torres Strait Island. There's so much work we can do there that can help expand and build and help accessibility and talk about unmet need. That's other pieces of work that I know that we've started to do here. So I guess that's a very broad brush and a couple of open-ended questions to folk on board. Mel, I'm very conscious of time and I don't want to take up more of your time than that, but I'm hoping that that gives everyone, or at least a little insight more than happy if people want to have a different conversation on specific areas, we can enable that. But I'm hoping that that will just give you a bit of a broad brush on that.
That's great. Thank you, Barb. And as always, thank you so much for your continued championing passion and belief, because you've lived it, of the benefits of partnering with consumers and all of our many communities that the health system needs to meet the needs of across Queensland. Are there any specific questions for Barb? You can pop them in the chat, or you can raise your hand in the app. Just seeing if anyone's waving their hand. Sometimes I have trouble finding the button. Barb is also going to stay with us for the session. So if there are any other questions or anything that you'd like extra information on, you can pop it in the chat and we can help you out of session. So it looks like, oh, here we go. We've got a question here from Hamza. Would you like to ask your question, Hamza?
Yeah, no, I just really, thanks for the introduction there. I guess, Barb, just reflecting back, thanks for making the time, but the key question from, I guess, a number of us who, I think you're right, there's been so much that's happened because of COVID, where lots of conversations have started to happen, which is really good. And I think the key thing is that what we want to know in terms of the practical side of things, knowing how complex all of this is if we can come away from this meeting just having some clear idea of how we can better partner with you from a multicultural perspective, and where there may be some specific areas that we can help, that would be really good, because then it sort of builds beyond the good energy over here to sort of the next level of stuff, which I know in my dealings with you, Barb, through the collaborative and so on, you're a doer. So I just want to know what we're going to be doing from a doing point of view.
Hamza, look, I love your backdrop, and it's lovely to see your wee face. It's just, sorry, I just need to say, because I feel like I haven't seen people for months now. I think that's a really, really important point. Talk is cheap. What we need to do is start getting some really hard lines down, because if we don't take the opportunity now, it will run away from us and we'll fall back. And one of the things I really noticed here, and I'm sorry I keep referring back to my home, but that's my experience, is that we had some really good formal networks, but also structures around how we could involve more diverse communities in the conversations we had. So we could actually start talking to people that were from those communities. Now, if there's a way that we need to, and I know I don't want to start talking about let's have more meetings just for the sake of meetings, because God, you know, we could spend our whole life having meetings. But if there's some places that we could have some core meetings with people that we actually could then get some tangibles, because I'm not sure what the next steps are. I'd like to have that conversation with people so we could jointly have an agreement about what we could get the most benefit of. If there's an opportunity for us to sit down and have those conversations, I'm really up for that. I don't have all of the answers, but I'm in a really good place to link us up to where we could. And if that's what we need to do, let's do that now while we've still got the engines running, rather than waiting. And so I'm really open to that, and I'm happy to make time for that. I will blank things out so that we could at least have those initial conversations and start driving people in the right direction, if you think that's where we should go.
Awesome. Thanks, Barb. And speaking of linking up and some great new opportunities that exist for consumers engaging with the department, Martin has asked if you could discuss a little bit about your view on the new Tier 2 committees, the role of consumers, and what changes this new structure might make.
Tier 2 committees. Look, to be perfectly honest, Martin, I'm very well known for my absolute allergic reaction to more meetings for the sake of them. I get very petulant about it, and so people have to convince me a lot that there's a value add in making another set of meetings to have another discussion, to maybe not, I'm much more about the actions. Give me something to do and I'm much more focused on it. However, with all due respect, the Tier 2 committees and a seat at the table provides a challenge and an opportunity for consumers. And I think that the challenge is, how do you get the right people at the right tables to have the voice? And the opportunity is to make your voice be more than just another voice at the table. And so I think that the Tier 2 committees provide us with an open door into that space. What we do with it is up to us. But it shouldn't just be another meeting that somebody has to attend to. And I think the challenge for consumers, and I know this is being recorded, so I'm sure John will have something to say about this to me. I think the challenge for consumers is to hold us to account at every Tier 2 meeting. What is the action that we need to come out of this meeting, and when will we see it done? And how do we need to be involved in it? Because otherwise we're just talking. And we've got to do more than that.
Yep, absolutely. And we really value everyone's time, all the consumers who pre-read and attend. We want to make sure that your time is having an impact. That loops in really nicely into a comment in the chat from Donata about how the information and advice from these sessions flows into Queensland Health. And perhaps there I need to apologise to Donata that we haven't kept her and perhaps some of the other organisations in the loop on these. What we actually do is feed through a written summary and some high-level recommendations to Queensland Health from these consumer conversations, and then we feed back in our e-alert the next week to attendees about what impact their feedback has had. It's so important that people can see that they're being listened to and that it's having an impact. And we would like to think that it's because of the collaborative approach that we've had here in Queensland, both with consumers, with NGOs, that we've had such great outcomes in this state. But we recognise that more can be done, and that's exactly why we've come together today. So thank you, Barb. We might move on to the topic of today's session, but thank you so much. And you're always welcome. We love having you along to speak to everyone. We know that we're the treat in your day, and we look forward to continuing to work together.
Thanks, Mel. Can I just make one point really quickly? One thing I would say to you, and it's a challenge for all of you, how do you support and make sure that you actually look after yourselves in this space? Because it worries me a lot that there are only so many of us, and you all bear a burden. You all bear a burden to the people that stand behind you. And I just want to make sure, I totally acknowledge that, but I just want you to actually make sure you look after yourselves and look after each other. All of this work is another component you have to do. So anything we can do to assist in that. Thanks, Mel.
Thanks, Barb. Thank you. And that's absolutely front of mind for us too, both for ourselves here at Health Consumers Queensland, but for all of you consumers and carers who we know you're juggling your busy lives as well as this important work that you do. Thanks, Barb.